Hi everyone, this is Dr. Kingston, and in this video I'll be talking about the innervation of the orbit. The objective for this video is to identify all of the nerves that provide motor, sensory, and autonomic innervation to the orbit and its contents. We're going to start off with the big one. The optic nerve is the largest supplying the orbit, and it's carrying special vision sensory innervation. It enters the orbit through the optic canal, which passes through the sphenoid, just anterior to the sella turcica. So here would be the sella turcica, there's the optic canal, and we can see that coming into the orbit right there. You can see the optic nerve here as it enters through the optic canal into the apex of the orbit, and then travels anteriorly a small way to meet the posterior eyeball. The nerve itself is composed of axons from ganglion cells from the retina, and these are going to pierce the sclera to form the nerve, and then they carry visual information back to the brain. The retina is covered in much more detail in the video going over the layers of the eye, so please check that one out if you have not already. From special sensory, we'll move right on to somatic sensory. Somatic sensory innervation to the orbit is carried by the ophthalmic division of the trigeminal nerve, and you can see here that the orbit is nicely subsumed into the green V1 territory here. The ophthalmic nerve enters into the orbit like most things that we've seen so far, so through that superior orbital fissure. Once it's there, it gives off its branches: nasociliary, frontal, and lacrimal. And I put them in this order specifically so you can remember NFL, but we're going to look at them in a slightly different order. Anatomically speaking, it makes the most sense to look at the frontal nerve first. It is the largest branch of the ophthalmic nerve, and it is also very superficial in the orbit here, as you can see. So here is where it is running, right there. It is going to enter the orbit here through that superior orbital fissure, and it is going to course very superficially, as I said, over the superior surface of the superior rectus and levator palpebrae superioris muscles. It's going to dive fairly close to the medial aspect of the orbit, and as it approaches about mid-orbit here, it's going to start to give off its own branches. The two that we are really going to focus on for this course here are, number one, the supratrochlear, which is going to continue out of the orbit by passing superior to the trochlea. So here's superior oblique, and here's that fascial sling, that trochlea that it wraps around. Supratrochlear nerve heads out over the top of that onto the skin of the face, where it's going to innervate the skin of the medial forehead and the medial superior conjunctiva. The rest of the frontal nerve continues as a supraorbital nerve, and the supraorbital nerve is going to exit the orbit here through either the supraorbital notch or the supraorbital foramen, depending upon your anatomy. This is pretty variable by person. As it exits onto the face, it is going to innervate the mucosa of the frontal sinus, so I should say that happens before it goes out onto the face, and then the skin of the lateral forehead and the lateral superior conjunctiva. The lacrimal nerve is much smaller than the frontal nerve. It is going to travel along the lateral aspect of the orbit straight up to the lacrimal gland, which it is bringing somatic sensory innervation to. The nasociliary nerve sits slightly deeper than the other branches, and it's easiest to see after reflecting the superior oblique muscle. So that's what's been done in this image. It travels medially in the orbit, and it gives off the long ciliary nerve fairly early in its course. The long ciliary carries somatic sensory from the eye, and it's also carrying some postganglionic sympathetics to the dilator pupillae muscle. All right, back to that main stem of the nasociliary then. As we see it traveling along the medial wall of the orbit, we get the anterior and posterior ethmoidal nerves. These are going to leave the orbit through the anterior and posterior ethmoidal foramina and head into the ethmoid air cells, where they're going to provide somatic sensory. The final branch of the nasociliary in the orbit then is the infratrochlear nerve. So we saw the supratrochlear nerve that exited the orbit by going superior to the trochlea. This one's going to do just the opposite. It goes out underneath that trochlea onto the face, where it's going to innervate the conjunctiva, the skin of the eyelids, the lacrimal caruncle and sac, and the side of the nose. Somatic motor innervation is carried into the orbit by 3 cranial nerves. These are the Oculomotor Nerve, the Trochlear Nerve, and the Abducens Nerve. And they are all going to enter the orbit through the superior orbital fissure. So I talked briefly about these nerves in the extraocular muscles video, but we're going to take a little bit deeper dive into the pathways of each of these here. We'll start off talking about the trochlear and abducens nerves, since they're pretty simple. The trochlear nerve exits the brainstem, travels anteriorly through the wall of the cavernous sinus, goes through the superior orbital fissure. It's going to pass through that fissure fairly superiorly, and then it just takes a short jaunt over to the superior oblique, which it usually reaches from a superior angle. The abducens nerve travels directly through the cavernous sinus to reach the superior orbital fissure. It passes through laterally, and you can find it here on the lateral side of the orbit, coming up to the lateral rectus muscle, which it usually approaches from the medial side. The oculomotor nerve has a little bit more to it. So this one innervates 5 out of the 7 extraocular muscles. It is highlighted here in pink, and we can follow its superior division up here to where it's innervating the levator palpebrae superioris and the superior rectus. And we can also follow its inferior division down here to inferior rectus, inferior oblique, and it would also innervate medial rectus, which is not shown on this cartoon. In addition to doing a lot of the heavy lifting for somatic motor innervation in the orbit, the oculomotor nerve is also carrying some additional types of innervation, specifically some parasympathetics, which you can see kind of indicated on the orange here. So let's take a look at those. The parasympathetics carried by the oculomotor nerve are headed for 2 muscles in the eye, the sphincter pupillae and the ciliary muscle, both of which are sitting right up here. The preganglionic parasympathetic neurons originate in the oculomotor root, and their axons are going to travel down the oculomotor nerve and into the ciliary ganglion here. In that ganglion, they're going to synapse with their postganglionic partner, and then the axons from those partners are going to travel up the short ciliary nerves and into the eye. And because we're talking about parasympathetics, it's not a bad idea to dive right into the sympathetic innervation for the orbit right now as well. Now, even though I'm going to be using the same illustration here, I am no longer talking about the oculomotor nerve. So sympathetics in the head, we're going to find coming up here on this vessel here, which is the internal carotid, and then its branch, the ophthalmic artery that enters into the orbit. What's important to remember about sympathetics traveling in the head and neck is that they don't form nice fat nerves like we see here for other things. They are going to form a plexus over vessels, so we call these perivascular plexuses, and they do this on the internal carotid up into the skull, into the cranium, and also out onto that ophthalmic artery. Right now we are talking about this pathway which leaves the internal carotid artery, and it is going to travel down into the ciliary ganglion. Now remember, sympathetic fibers that have made it this far up into the head have already synapsed. So to get here, they first had to leave the spinal cord as the preganglionic neuron. That would travel into and up the sympathetic chain to the superior cervical ganglion. It would synapse there, and then the postganglionic axon is what is going to be riding these perivascular plexuses. So we are seeing a postganglionic sympathetic axon, cluster of axons, coming off that perivascular plexus, traveling through the ciliary ganglion, and then on to those short ciliary nerves to reach the eye. Additionally, we have some postganglionic sympathetics from the same perivascular plexus here that are going to jump up onto the ophthalmic artery and then off onto the nasociliary nerve and its branch, the long ciliary nerve. and those will also approach the eyeball here. These are specifically for the dilator pupillae muscle. If I flip back here, this pathway here through the short ciliary muscles, these are going to intraocular vessels. So these are what would dilate or constrict the blood vessels in the eye. So the ciliary ganglion, as we've seen in these last couple of slides, have a couple different types of fibers moving through it. We started off with the pre- and postganglionic parasympathetic, shown here in orange. So we have our preganglionic coming down and our postganglionic making up most of this ganglion, right? So this is mostly going to be cell bodies and synapses around them. And then the postganglionic parasympathetics traveling out through the short ciliary nerves. We also saw some postganglionic sympathetics leave that perivascular plexus, travel through the ganglion without synapsing, and also ride those short ciliary nerves. This makes it look a little bit more like a traffic interchange than a ganglion. Now, we're going to add in some somatic sensory fibers as well to really make it look like a traffic jam. These are coming from the nasociliary branch of V1, and just like the sympathetics, they don't do anything here. They're just passing through. They are heading down to the inferior division of the oculomotor nerve, and they're going to be supplying somatic sensory innervation to these muscles, so our inferior rectus, inferior oblique, and medial rectus, as well as to the tissues in the inferior orbit. So there's a lot going on here in this tiny little ganglion. We find not only parasympathetics, but also axons from sympathetic neurons and somatic sensory neurons. And that is going to bring us to the end. Let's do a practice question. The correct answer here is C. There are not somatic motor fibers passing through that ganglion, but there are all the other kinds listed here. And that is the end. Thank you for watching.